So this is how you will change the linen of an occupied bed. So first, of course, you need to assess the client if there is a need for you to change the linens with the patient on it, or the patient can get out of bed, so you assess the capability of your patient. In this case, my patient is a stroke patient and he is confined in bed. Okay, so he cannot get out of bed. So I have already introduced myself. I have identified my patient, which is Mr. Tuboso. So I have to gather all the equipments that I need. So what do you need for changing your linens? Of course, you need your, these are your linens. So this should be arranged from top to bottom according to your use. Since your bottom sheet is the one that you will be using first, so it should be at the top of your arrangement. Next in use is your draw sheet. So your draw sheet should be there properly folded. If you need an absorbent pad, then there is your absorbent pad, and then you have your top sheet, and in some cases you need a blanket, so that will be on top of your bed making. Now, if you are using a
Dito. Sige lang, ma'am. 3, 2, 1, action!
Now, if you are using a rubber sheet, since there are hospitals that are still using the rubber sheet will come after your bottom sheet, rubber sheet, then your draw sheet. You don't need an absorbent pad, maybe because you have the rubber sheet, and then you have the top sheet. So you need to perform hand hygiene. So you can probably wash your hands, or you can use your sanitizer or your alcohol. Okay. You have to adjust the height of your bed to a comfortable working position. So this one is comfortable with me. It's not low, not too high. And then I need to loosen the linens. So if you are using a bath blanket to cover your patient, you can put the bath blanket under this one before you remove the linens. But if you don't have a bath blanket, then when you remove the linens, leave your top sheet. So just loosen your top sheet in top of your patient. Okay, so I will loosen starting from that side, from the farther side going to the near side. So I am from that side already. So make sure that your patient is moved already to one side of the bed, so that you will work on one side first of the bed, since you are making an occupied bed. So my patient is there on one side. Be sure to put the side rails up. Okay, so make sure that you have raised the side rails up, and that is for your patient's safety. So you loosen from the farther side to the nearer side. So loosen for all your linens. Okay. Since I am not using a bath blanket, be sure that your top sheet is not dropped, it's loosened. Okay. Then you have to fan fold this one, or you can roll under your patient, at the back of your patient. Okay. Be sure to really tuck it under your patient. Now make sure, if your patient's linen is soiled, make sure you have worn your gloves to protect yourself. Okay, so I have tucked it under my patient. Okay, I will get now my bottom sheet. I will apply first my bottom sheet. Again, make sure that you have to locate the center fold. So this is the center fold. So I will put the center fold. Okay, so for your bottom sheet, the tuck part is the head part. So the foot part should be just level of the bed. Okay, so to get the center of the bed, you divide the bed into 4, and where the line meets, that is your center, and so you have to put your center fold on that part. Okay, so get this, open your sheet. Okay, so the foot part should be in level of your bed. Okay, so apply. Okay, so make sure this edge is level with the edge of the bed. Okay, so you take this, open this part. Okay, and then fan fold this under your patient's back, just under your fan folded dirty linen. Tuck it under the dirty linen. Okay, so make sure you have a smooth bottom sheet. You see the fold of your linen is here at the side. You will see the line of the folded sheet. Okay, then get your draw sheet. So this is the center fold, so put it at the center, open. Okay, then pull it towards you. Sorry, because this is too big, so I folded it. Okay, and then again fan fold this linen towards your patient, and tuck this under your, on top of your bottom sheet, just under your dirty linen. Okay, make sure it is smooth. Okay, if you have a protective sheet, you can put it. Okay, so you also fan fold. And put it together with your draw sheet. Okay, now I will tuck the head part of the bed. So hold the mattress with your non-dominant hand, that is the hand near you. Lift a little your mattress and tuck the head part of the bed. Okay, miter, top, put it down, and then tuck it around. Use proper body mechanics. Now I'm done with one side of the bed, so I can now transfer my patient to the other side of the bed. Okay, let us transfer to this side, sir. Can you help me? You just slide. You can. Okay. Okay. Now, in this scenario, you will see that your patient is in supine position, but it can also be done with your patient in a side lying position, and then you can ask your patient actually to hold on the side rails of the bed while you are doing one part of the bed. So now our patient is on the clean side of the bed, and let's just consider that this is another patient, and my patient can I can turn him to the side. There's no contraindication. So my patient is turned to the side, and I am asking him to hold the side rails. I will now remove the dirty linen on this side. So you just gather the linens to the center. Okay, roll. Put it in a hamper. Okay, and then you now pull the linens to this side, the linens that you applied a while ago on the other side, the other side of the linen. Okay, be sure your patient will not fall if you will pull the linen. Okay, so same thing with your rubber sheet and your protective sheet or pad. Okay, so this time you need to pull exerting a little force to make sure that you have pulled your linen properly. Okay, pull your linen. Okay, to make sure it is properly stretched, and then tuck the head part of your linen. Okay, with your non-dominant hand holding the mattress, the other hand tucking your head part, and then pull like this. Okay, with my knees bended, not my back. Okay, so pull, make it secure. Okay, and then lift this one, make a triangle. Be sure this part is straight, and then tuck, and then you have to miter your corner as we did in the unoccupied bed. Then tuck from here. Okay, tuck under until you tuck all the linens until the foot part. Okay, so make sure that you have a smooth linen applied to your patient. Okay, so this time you can ask your patient to be to position, or you can position your patient at the center of the bed. Okay, sir, are you okay? Okay, so this one should not be trapped. Okay, and you are now ready to apply your linens. Now we are applying the top sheet. Okay, without removing the old top sheet, so that your patient will be properly draped, you put it on top. Okay, make sure you locate the center fold of your top sheet. So this is my center fold because this is the hem. Okay, so where is the center of the bed? So it's here. So this is the edge. Okay, you have to open. Okay, and this one should be level at the head part of the bed. This time your top sheet should be tucked at the foot part. Now I want to emphasize that when applying the top sheet, make sure that the clean side of the linen is the one in contact with the patient. When you say clean side of the linen, this is the one without the hem. This is the wrong side This is the hem. This is the wrong side of your linen. This is the clean side without the stitches here. Okay, so that is the top sheet, and vice versa for your bottom sheet. The clean side should be the one on top, and the wrong side, that is the one in contact with the mattress. Okay, so get this one, spread, okay, pull, okay, then unfold to the center. Okay, don't cover your patient like this. You can do it like this. Okay, and then you can actually here you can fold now to this side before you go to the other side. Okay, so I will tuck one side to make a clean corner. So just the same technique with your non-dominant hand, hold the mattress, okay, and then tuck the foot part, okay, pull a little, make a triangular, make a triangle here, pull the linen to this part, okay. So you see this should be straight. This one is with this angle, okay. Leave that one and then tuck this part, okay. Bring this down so that this part should be hanging freely, okay. Then you go to the other side of the bed and you make the other side of the bed. Okay, so spread your top sheet. Okay, there should be a fold here. That is your, how many inches? 6 inches, right? So actually you can make another fold if you want to make it clean for your patient. Okay, and then tuck this part. Make sure you see this folded line. It should be at the side of your mattress too, to make sure that you have equal linens on both sides. Okay, hold your mattress with non-dominant hand, tuck the foot part, pull your linen, okay, and then miter again your corner, okay, tuck, okay, put this down. Now make it neat, okay. Now to prevent foot drop, okay, you pull the linen on the foot part to give space for your feet to move. Okay, so we need to change also the pillow cover into a fresh one. So sir, can I get your pillow? Support your patient's head. Okay. Remove the dirty pillow cover. Put it in a hamper. Okay. So get your pillow cover, and then you have to grab the edge of your pillow cover. Put your hand and grab this edge of the pillow and put on your pillow cover. It should be away from you, going away from you, not towards you, okay. Avoid contact with your uniform, okay. Avoid shaking your linens, okay. Microorganisms will fly, okay. And then put back to your patient's head. Make sure you are always supporting your patient's head, okay. Are you comfortable, sir? Okay. So the edge of the pillow, the opening of the pillow should be facing the window and not facing the door to make it to have a clean appearance of your pillows. So after making the bed, your patient is comfortable. Are you comfortable, sir? Okay, you feel good? Okay, so position in a preferred position, you can adjust again the height of the bed. Lowered, be sure when you leave your patient, the bed is lowered for the patient's safety. You can ask the patient if he prefers the semi-Fowler's position or whatever position he would like to have. And then you need to perform hand hygiene, of course. So if there is a faucet, you can do a hand washing. And then of course, you need to document your procedure. And so that is how you change a bed with a patient on it or occupied bed.